Your blood sugar can look perfectly normal on every test for years, while real damage is building up underneath. And the one number that would catch it early is almost never checked. And that number is fasting insulin. Most annual labs only check fasting glucose, your blood sugar, and maybe your hemoglobin A1C, which is that 3-month average. But by the time those two climb, the damage may have been building for years. And that gap between when the harm starts and when your labs finally notice it is exactly where people get blindsided. When your cells start resisting insulin, which is that hormone that moves sugar out of your bloodstream, your body doesn't let your sugar rise right away. Instead, your pancreas fights back, pumping out more and more insulin to force that sugar into cells. So your glucose stays normal, but only because your insulin is running high behind the scenes to keep it there. And your labs look fine, but the strain is invisible. In a big study published in Lancet, where they followed thousands of adults before any of them were diagnosed with diabetes, insulin resistance was already showing up 3 to 6 years ahead of time. By the time sugar levels finally started going up, the process had already been years in the making. And that hidden high insulin isn't harmless while you wait. It drives fat into your organs, and it pushes up your blood pressure, and it wears on your blood vessels the whole time your blood work says you're fine. And it's also why some people seem to turn pre-diabetic out of nowhere. The sugar only slipped after the insulin had been compensating and slowly failing for years. So this is where looking one layer deeper can really prevent a lot of the damage. Adding fasting insulin to a center panel is fairly cheap, and the earlier you spot that rise in your insulin levels, the easier it is to reverse. And if you're carrying extra weight around the middle, or if you have a family history of diabetes, or if you just want the earliest possible read, it's one of the highest value numbers you can ask for.